Hi, I am Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery, Venous and Lymphatic Disorders. I am pleased to introduce to you 4 excellent papers of the May issue of the JVSVL. You can download them this month free of charge. The Editor's Choice article this month is the 2020 update of the CEP classification system and reporting standards of chronic venous disease. The document was authored by Dr. Fedor Lurie and colleagues of the CEP Task Force of the American Venous Forum. The task force adopted the revised Delphi process and made several changes that including adding corona phlebectatica as the C4C clinical subclass and introducing the modifier R for recurrent varicose veins and for recurrent venous ulcers. This update describes all revisions and the rationale for making these much needed changes. Please adopt the updated CEP classification and use it both in your clinical practice and in research studies on chronic venous disease. The next paper I would like to introduce to you is our CME paper this month. It is entitled "Spine Stabilization is a Risk Factor for Development of Pelvic Iliac Vein Lesions." This paper was authored by Dr. Peter Pappas and colleagues from the Center of Vein Restoration and the Center of Vascular Medicine in Greenbelt, Maryland. This retrospective study identified 18 patients with a history of lumbar spine stabilization procedure who presented with iliac vein lesions. 17 had obstruction and 1 had venous aneurysm. 6 lesions were bilateral. The left common iliac vein was involved in 14, the right in 3 patients. The right external iliac vein was affected in 3, the left in 1 patient, and 1 had inferior vena cava obstruction. The authors concluded that patients with symptoms of pelvic or lower limb venous disease and a history of spine stabilization should undergo imaging to rule out pelvic venous lesions. The next paper I would like to introduce to you is entitled "Comparison of Computed Tomography Venography and Intravascular Ultrasound in Screening and Classification of Iliac Vein Obstruction in Patients with Chronic Venous Disease," written by Dr. Fabio Rossi and colleagues from Sao Paulo, Brazil and Phoenix, Arizona. In this prospective study, CT venography's power to detect iliac vein obstruction of 50% or greater was compared with IVUS in those patients who had advanced chronic venous disease, CEP class 3 to 6 limbs. CT venography had a sensitivity of 94% and a specificity of 79.2%. The positive predictive value was 94% and the negative predictive value was 79.1% with an overall accuracy of 86.7%. So the take-home message of this paper is that CT venography is a powerful screening method in determining the point of compression and the degree of iliac vein obstruction when compared with intravascular ultrasound examination. The final paper I'd like to introduce is on the impact of ligation versus repair of isolated popliteal vein injuries on in-hospital outcomes in trauma patients. This was authored by Saskia Byerly and colleagues from Miami, Florida and Los Angeles, California. This study compared in-hospital outcomes of repair versus ligation of isolated popliteal vein injuries in 308 patients. Surprisingly, analysis of data from the National Trauma Data Bank found no significant early differences in lower extremity amputation, in-hospital mortality, and in-hospital amputation-free survival between the two groups. So the take-home message of this paper is that early, and I have to emphasize it, early in-hospital outcomes are not different between ligation and repair of isolated popliteal vein injuries. It is important to note also that there were several limitations in this paper, including treatment bias and reporting bias, owing to the retrospective design of the study. These were just 4 excellent papers from the May issue of the JVSVL. To access this article, please log on to www.jvsvenous.org. Let us know if you have any comments or suggestions on how to improve these videos. Thank you for watching, and see you next time for the highlights of the July issue of the JVS Venous and Lymphatic disorders.